Hey everyone, welcome to the Genghis Show, a unique, informative, and funny show about pets and animals. I'm your host, Cary Chan, and this is my co-host, Genghis, and my very best friend in the world.
Oh, thanks there, Pops. How you doing today?
I'm doing great, Genghis. How are you doing today?
Can't complain. I'm very excited, looking forward to everything that's going on here. So why don't you tell us all a little more about the show?
Sure. On today's show, what we're going to talk about is what concerns all of us pet parents, is that our pets are healthy, and when you guys do get injured or sick, that you guys get the best veterinarian care. And to help us with that today is our resident veterinarian, Dr. Richard Calland.
Our own veterinarian, Dr. Richard Calland, treating your sick human companions differently.
Hey Richard, how are you doing today?
Hi, Cary. Thanks for coming by.
Hi, I'm here with Dr. Richard Calland from Slow Vet Medicine. He's going to be a resident veterinarian answering your questions and our questions in regards to your pets. So how did you come about with the name of Slow Vet Medicine, Dr. Calland?
I read a book written by Dr. Michael Finkelstein for humans called Slow Medicine. And as I read it, I thought, gee, that's kind of the way I've been practicing for a long number of years. So I adopted it.
So what is the difference between your approach as opposed to traditional veterinarian medicine?
Good question. The practice of veterinary medicine has changed dramatically over the last 20 years or so. And in my journey of 40 some odd years in practice, I've found that the most beneficial approach to dealing with the health of my patients is to educate their people.
So could you give us some examples of how you would treat an animal as in your practice as compared to the traditional sense of veterinary medicine?
Sure. I think one of the most common things we see are diarrheas, sometimes vomiting. Vomiting is a little more serious symptom, but they occur often together. And conventionally, if you take your vomiting diarrhea dog into a hospital, they'll usually want to admit it and do some tests, put it on intravenous fluids because you have to give the digestive tract a rest and sort of treat symptoms. They can easily stop the vomiting and the diarrhea with pharmaceuticals, usually cover it with antibiotics in case there's a bacterial problem. They don't need to be so reliant on these potent medicines and all the expense that goes with it as well.
Sure.
And I have to be very careful. Obviously, there's serious causes for vomiting and diarrhea, but vast majority are not. They get over it on their own. So through questioning and allowing them to gain some appreciation that their animal's not going to die, it's okay, it's stable, the vomiting's probably going to stop, and it'll take a few days, and we keep in touch by phone every day. I give them sometimes twice a day. They will give me a report. And so we modify according to what the animal is doing, but most of them get better. And sometimes it's just the owner's high level of concern that they need to go for the fast medicine approach. And they use pharmacology to stop the vomiting and stop the diarrhea and so on, but it just is taking over from what nature would do, and the end result usually is much better, but it takes time, and that's slow medicine is that way. But at the end of it, you gain a lot of understanding about health and can move forward. We humans, of course, are very complex. Our animals and pets are pretty simple compared. We influence them a lot, and they're part of all the equation, whether it's human health we're looking at or animal health. We're all interrelated and affecting one another. And one environmental factor like a herbicide may all of a sudden become important to an individual dog that is either genetically predisposed or is weakened from poor food or weakened immunologically from too many vaccinations.
Okay. And diet does play a big part in that, you think?
Huge in their pet health. It's maybe the biggest factor.
So would you say it's more preventative approach that you take sometimes?
Oh, definitely. It's definitely, and I always have felt my patients when they come in and they're humans, and if they have long chronic problems to deal with, it detracts so much from what's the most joyous experience, having your companion. And so I always want people to share in that feeling of wellness and well-being with their animals that they love. So
It's great. Thank you very much for your time today, Richard.
thanks, Cary.
The Genghis Show.
Now, Genghis, it's time for you to shine. Now you can tell the folks at home who you are, what you're all about, and what the show's all about.
Cool, well, why don't we watch this?
Genghis is a 4-year-old Mexican Chihuahua. He loves to play and goof around, whether it's at home or at one of his favorite parks. And now he is off on a new adventure, co-hosting a show for pet parents. He and his dad, Cary, do everything together, whether it's going for a car ride, visiting a new park, or a nice meet and greet with some people. Genghis is very excited about the show, which will provide pet parents with valuable, solid information so they can be better informed and have fun watching it.
The Genghis Show.
Hey, the world of pets is so fascinating that each week our social media expert, Bonnie Sainsbury, will keep us informed of what's going on.
What you got for us, Bonnie?
Hi there, I'm Hayden Clues. We'll be talking to Bonnie Sainsbury now about her weekly bit she's going to be doing with us called Pet Social. Bonnie?
Hi, it's Bonnie Sainsbury and this is Pet Social. And today I'd like to talk about the people that had to leave their pets in an emergency in Fort McMurray. Now the SPCA and a number of other shelters stayed and rescued those pets. But something that's very, very important is to be able to identify your pet and to keep the information up to date so that when someone rescues your pet, they're going to be able to find you right away. So you can get a tattoo or a chip for your pet, either your cat or your dog, at a shelter, an SPCA, or a vet. And it's very inexpensive when you consider that your pet could be lost. So I'd like you to think about doing that the next time you're at a vet. Next week, I'll be telling you a little bit more about what's happening on the web with our pets. So, this is Bonnie Sainsbury, and this is Pet Social.
The Genghis Show.
Hey, Cary,
Hey, Genghis.
you want to see something cool?
Sure.
Well, let's go down to the SPCA where Hayden Clues is talking to Kim, who's a specialist there, and they're going to talk to us and show us a couple of really cute little kitty cats that have been hanging around there for a little while now.
Awesome. I can't wait to see it.
Get ready for a cuteness overload. Meet Munroe and Mouse. Hi there, I'm Hayden Clues, and we're at the Vancouver SPCA once again here, and I'm talking to Kim, and we're talking to a couple of cute little kitty cats that I've got here. This guy here, pardon me, remind me on the names. I got Munroe and Munroe and Mouse right here hanging out. And were you saying ages on these guys here?
Well, we were told they're 7 weeks. I think this one, Munroe, is 7 weeks, but little Mouse is a little bit smaller. They're not from the same litter.
Oh, okay. I was gonna ask actually. Yeah.
They actually came down from Williams Lake. We have several shelters around the province.
Oh, okay.
And they came on our Drive for Lives program, came all the way down to find their homes here. However, they're still too tiny and too young, so what we're doing now is they're in foster.
Oh, okay, I see. And how does that work exactly?
Well, if we have young puppies or kittens, or if there's a medical surgery being done, we look for foster parents. You don't have to adopt. So sometimes people will say, no, I don't want to foster, because they think, oh, then I have to adopt.
I see.
Yeah, so it's a way to kind of help us out, help out the animals, kind of see for some people, what it's like to have. Oh, it's just ridiculous.
The cuteness
Oh,
overload
gosh.
is,
Yeah.
it's overwhelming.
So these guys will be, in a couple of weeks, they'll be available for adoption. All of our animals, our cats and dogs and rabbits, are spayed and neutered before they go home. So we're waiting for that too. So once we do the small little ones, as soon as they're big enough, old enough, we'll spay and neuter them.
For sure.
They're so cute.
I can't believe how cute these guys are, and they've been hanging out with you in your office all day, you say,
Yeah, hanging out with me, making a mess on my desk, and playing with my dog. But yeah, they're just trying to get lots of socializing and handling and things like that.
And how are they doing so far with that?
Amazing. Little Mouse is a little bit shyer. You can
Yeah,
see she's just
you can
gonna.
tell, yeah.
I'm just gonna stay right here. But this little one, Munroe, you can see she's trouble.
I was gonna say, she's getting herself in a whole bunch of trouble already, I can tell.
Chewing on Mouse's ear.
Yeah, chewing on my finger over here.
Yeah.
These guys
Good. It's so important. I don't know if you realize that with kittens, like dogs, we talk about socializing. There's that window of socializing when they're young.
Even with kittens, eh?
Under 3 weeks, about 14 weeks, it's so critical to get them exposed to different things. Even, we don't think about this, but crate training. Because think about when you take your cat only to the vets, right? Usually, right?
Yeah, of
So
course.
once a year you take them out, they're not used to going into the crate. So we do lots of crate training, getting them out, meeting different people, in the car, things like that, just like a dog.
Oh, that's perfect. Well, I gotta say, I don't think these guys are gonna be hanging out very long here. I'm pretty sure, in fact, I might be the one snooping them up today. I'm not too sure about that. But come on down to the SPCA and check these two cuties out, because I swear, they're not gonna be here very long. Thanks very much, Kim. Oh my god, these guys are perfect.
The Genghis Show.
Hey, hope you guys enjoyed our show.
Because we got many more of them to come.
We want our show to be interactive and include viewers like yourselves and your pets. So please send us all your stories, your pics, your video clips, and if we like what we see, we'll put you on our show as well.
Well, yeah, that was a pretty cool show. I gotta admit, there should have been a lot more of me in it, but it's pretty cool.
That was really cool.
So, what do we do now?
We've got our last segment, and it's called Pet Moments.
Yeah.